kuthiwa ndine-HIV, maybe uye ekliniki wafika watesta okanye for whatever reason ubugula okanye ubune-fever okanye ubune-flu. Xa ufika ekliniki wathiwa watesta ngoku kuthiwa i-test yakho i-positive, you are HIV positive. Ndithini? Where do I go from here? Ndithini, Sister Yonela? Ndithini? I'm going to speak to you as a nurse. I care for patients living with many diseases, Monday to Friday. I counsel people on many diseases, Monday to Friday. And thus far, I have seen the effect of stigma and people being ashamed and embarrassed. They don't know who to talk to. They don't know what to do. So I hope le video izawunceda umntu nje mhlambi ongakwazi ozifilisha into yoba andinaso isibindi sothetha mhlambi nomamam okanye nosista wam okanye even nonesi ekliniki, even nogqirha ekliniki, ndinemibuzo but andinasibindi. You see, yes, I'm still struggling and wrestling with this, you know. So masiqale eqaleni qala. So utestiwe. Xa utestiwe ke i-test, it process, it involves 2 tests. Uyatesta okokuqala ibe nemigca emibini, meaning positive, okay, after maybe 15 minutes. La positive wokuqala funeka confirmwe, it must be confirmed. There must be a confirmatory test. So they do the second test. If the second test also has 2 lines, that means it has been confirmed that there is HIV in your blood. Okay? You are not HIV. Please, you are not. You are living with HIV. Okay? Don't let it be your identity. It's not your identity. You are not HIV. You are a person. You are Yonela, you are Bongani, you are Samuel, you are your person, you are who you are. And in the oba was test or HIV positive, it does not mean that is your identity. So in most cases melba ibanjalo ne zi-2 tests abazenzayo. The first line and the confirmatory test. Okanye, if ziya contradicta, the other one is negative and the other one is positive, then they will take blood now, ekuthiwa yi-ELISA. Libuya within a day or 2, results to know the results. Now, ugqiboxelelwa esi status sakho uba you're HIV positive. What is HIV? HIV yintsholongwane. It's a virus. Germs, there are many germs. There are bacteria, there are viruses, there are fungals. I'm not sure if they couldn't label, but the bacteria which needs antibiotic, fungal which means antifungal, viral which needs antiviral. So i-HIV yintsholongwane ye-HIV ne ibaphi iba segazini lakho. Xa uinfectwe yiyo iba segazini lakho apha emzimbeni. Yenzani emzimbeni wakho? Iyamosha. That's all I can say. It's destructive. It comes in and it destroys your immune system. It comes in and it destroys your immune system. Kanjani? Iyangena apha emzimbeni wakho, ifike iutrike umzimba wakho, ithathe amajoni omzimba la ayi-CD4 count iwenze HIV. And it does that. I think it's called a replication. I don't know if it's a replication or what, but it does that. It just goes on doing that, changing your CD4 count cells, which are your soldiers, switching them and making them into HIV. So as bixesha lehamba ungekho kwi-treatment wena, it's like a scale siwa kanje. The more HIV, the less the CD4 count. Ubungumntu kwi-treatment, i-CD4 count yakho iya improve, then your CD4 count goes up, the viral load goes down to the point of being undetectable. So sibana two things. It's never viral load. If viral load is the amount of the HIV in your blood, it's in copies. And then we have a CD4 count. CD4 count ngamajoni akho omzimba. Your CD4 count cells, it's your immune system. We all have CD4 count cells. Regardless of our HIV status, we all have CD4 count cells, which is our immune system, which helps us to fight disease. Our immune system is what helps us to fight even umkhuhlane. If there's a flu, your immune system gets activated. Even if you get a cut, your immune system gets activated to heal that cut. You understand? So we've done the viral load, we've done the CD4 count. Now when if you're infected with HIV, the infection or the lifetime of the infection has stages. There is stages 1, 2, 3, and 4. Yeah? In stage 1, you will not have any symptoms. You won't even know something is wrong. But some people do. Some people, they get a flu. Some people, they get swollen lymph nodes. It swells right here or in the neck. And it's basically showing to you that your body is fighting something. Stage 2 is common infections, man. You get infections a lot. You get ear infections a lot. You've got sinuses a lot. You get what is this called? But you get an infection in the corners of your mouth. It's angular cheilitis. You get infections like that. And then there's stage 3, which diseases like TB. And then there's stage 4, many diseases, okay? Meningitis, different types of TBs, as in lungs that are not pulmonary TB. It's called extrapulmonary TB. That is usually stage 4 of someone who has HIV. All these things that I've mentioned, I'm mentioning them happening in someone who has HIV. That I'm not saying that someone who has meningitis has HIV. No. You can have meningitis and you don't have HIV. You can have TB and you don't have HIV. But I'm making an example in terms of the stages of someone who's HIV positive. And the opportunistic infections that can take advantage of their weak immune system. Now, you know now what HIV is, what is a viral load, what is a CD4 count. Now, sister, what is the treatment? Now, I want treatment. Oh, I love patients like that. There's patients who be like, sister, I want treatment now. I want to sort this thing out. Oh, I love such patients. So, when it comes to being tested HIV positive, there is treatment. There is treatment. You don't have to get sick at all. There is treatment. It's called antiretrovirals, okay? It can be a tablet. In some countries, they already have injections, I think in the US, but in South Africa, we still have tablets, okay? There are many tablets. They are single tablets. For instance, some people are on a tablet called TLD. They take it in the morning. Some people on a tablet called TEE, which contains efavirenz. They take it in the evening. Some people are on many. Some people are on Dumiva, because it depends on your kidneys. It depends on many things which medication you will be on. Your kidneys, your mental health, everything, and also the other medication that you may be on already. And then now you have been found to be HIV positive. But the most important part is that with medication, you must take it every day, the way that it has been prescribed. You have to take it every single day. If you take it once a day, take it once a day. You have to choose the time you want to take it. For instance, if the tablet is meant to be taken in the morning, set an alarm. Set an alarm on your phone. We have nice phones. Set an alarm on your phone. If you know you want to take the tablet every day at 7 in the morning, 6:30, set an alarm. Pill at 7. And then you drink your pill. If you take them twice a day, do as such. And use your support system. Use your support system. I take medication for certain things. And my husband is my support buddy. He is my treatment buddy. He always makes sure, baby, did you drink your pills? And I'm like, oh yes baby, I did. Oh no baby, just please bring me my pills. You know, you use your support system. Let them remind you. Or can you put something in the fridge to remind you to take your tablets? So we've talking about tablets. And the next important thing is adherence. It's so important that you take your pills the way you should take them, because if you do that, then they will be successful in controlling the HIV. So when you start taking treatment, it depends on how much viral load you had in your system, how much of the virus was there. Some people it can take a month, but average it can take 3 to 4 months. It depends on what medication you are taking. It can take 3 to 4 months. Okay, so bloods will be taken, a viral load test will be done, and if you are adherent, your bloods should come back undetectable, meaning that even though there is HIV in your blood, it cannot be detected. Do you understand? It's like someone opening a closet and putting it inside and closing it out, or putting it in a drawer and closing it out. It's locked up. Do you understand? It's inactive. It's been deactivated. The HIV can no longer now continue damaging your system, damaging your CD4 count cells, can no longer make you sick. If you do get sick, it's because you are a person, not because of HIV. Now, your adherence, meaning your compliance on treatment, is important because I know there's a name, there was a research that was done, I think it's treatment as prevention, TESP, yeah. Because there is a term that is called TESP. It's treatment as prevention. So if you are a couple and then one of you is HIV positive and the other one is HIV negative, the one who is positive, if they are adherent to their treatment, they can actually prevent the other one from getting infected with HIV. It's called treatment as prevention. You can look it up if you are interested. It's a research that was done, and it was proven that if the person who is living with HIV is on treatment and they are undetectable, then they will not infect their partner. Okay? They will not infect their partner. And they will not infect their baby. If you are pregnant, you will not infect your baby. Even when you want to breastfeed, don't let anyone judge you. Don't let anyone tell you that as an HIV positive woman you cannot breastfeed. Yes, you can breastfeed. It depends on certain things. Things like, what is your viral load? Are you gonna be able to breastfeed your child regularly? Because remember, you have to breastfeed your child exclusively for the first 6 months. As someone who is living with HIV, you must not mix feed. The mixed feeding is not allowed. What is mixed feeding? It is giving your child formula and then giving them the bottle. You have to choose one. Choose the one that works for you. If you choose the breast, then you stick with the breast. If you choose the bottle, then you must ask the nurse to explain to you about AFAS. It's just a way of checking if this person who wants to use formula will be able to use it in a healthy way, in a hygienic way, in an appropriate way, in a sustainable way for their child. So that is come to breastfeeding. And then the other thing is, when you are breastfeeding, your child will be prescribed it's prophylaxis, and it's like PEP. Yeah. For instance, I will make an example. If a mother is HIV positive, their viral load was undetectable, and they pregnant and they have their child, immediately that child will be tested. PCR test will be done, and then that we will check we'll do also a viral load at that time, and we will check the mother's previous viral load. And that child will be, if the mother is breastfeeding, that child will be on Bactrim syrup and then nevarapine syrup, and they will take it according to the child's weight. And then we will wait for the results of the mother, the viral load. Usually it comes back after 3 days, and then if that mother's viral load result is undetectable, then that child will stay on the I believe, I might be wrong, but that child will stay on Bactrim because they are on the breast, and then on nevarapine for 6 weeks. But if that mother's viral load is not okay, then that child will drink 3 medicines. It will be Bactrim because they are breastfeeding, it will be nevarapine, and it will be zidovudine. All right, now let's go back to I tested positive. Now what? Yabona ke ngoku xa sendithetha, talking now in just person to person terms, not maybe I'm your nurse or what. One thing I can tell you is that HIV has no power. It doesn't have power. Science has given solutions like ARVs. It has no power. You are the one who gives it power, and do not give it power. Stop giving it power. Just take the tablet. Just take the tablet. And then the other thing that people have a challenge with is with their partners. Do what is morally right. Have your partner tested. Okay? Go test. Maybe you are pregnant, you don't even test, but now you are being tested and then it says positive. Aibo, kanjani, how can I be HIV positive? Aibo, I have a husband, one husband. Just get your husband to go test as well, and you guys will take it from there. Just get your partner tested, because when you, especially if it is someone that you live with, when you don't tell them your status, it's going to affect the way you drink your tablets. I'm telling you, it's going to affect your viral load, because now you're going to have to sneak. Now you're going to have to think, let me place this medication under the mattress. I know someone who said they even dug outside and they put it outside, and they would pretend to go pee at the same time. When generations started, they would pretend to go pee, then they would drink the tablet. It worked for them, but it can be such a challenge. Just speak to your mate. Speak to your mate. And speak to your mate. Find a way. Bring them to the clinic. Find a way to get them tested. And when it comes to the shame, that's all I can say. Because kaloku, HIV is a disease that affects people. Don't allow that shame, no, don't allow that thing to it. You understand? Because that's what might kill you. It might be because of the shame. When it comes to disclosure, I can say disclose to someone that you trust. Disclose to someone that you know does not have a blabber mouth. Some people have that disability. They just pep, pep, pep. They cannot keep quiet. Pep, pep. So those people, they have a challenge of keeping things in confidence. Don't share it with that person. Share it with someone that you can trust, because it's going to help you a lot. You're going to be able to open up to this person and share this burden with them. Yeah? But all in all, as a nurse, as someone who has seen people living with HIV, I see how they live, and I've seen how they can have a positive life, and they can continue with their lives, with their careers, they can have babies, they can live their lives just like everyone else. HIV is defeated. It has no power. Hashtag HIV has no power. So yeah, so if you're someone who's just been tested, don't worry, it's not the end. Don't worry, it's just a beginning of a journey, okay? And you won't be alone. Speak to your nurses. If you need counseling, tell your nurse you need counseling. Some people need counseling, okay? I know someone who fell into depression because they were tested positive. So just tell your nurse, they can refer you to the counselor, to the therapist, or the psychologist, and then they will counsel you, okay? Otherwise, HIV is not a death sentence. It was before, but it's not now. It's not. And I mean, in some countries there are even injections that you just inject once every 2 months, and I think it's a combination of cabotegravir or something, and something else, but you understand. So it's like that. So I hope what I've shared helps someone. Even if it helps one person, I will be glad. We can talk about PEP and PrEP the next time we talk. Otherwise, HIV has no power. No to stigma. Don't stigmatize people. Let's actually, in summary, I want to say, let's not stigmatize people. Let's not stigmatize people, guys. Let's not stigmatize just because someone has this condition. We stigmatize them, we put them in a certain box. Let's not do that, because such people are people who need us the most, okay? Yeah. As family members, stop gossiping about people who are HIV positive, because you don't know, maybe your sister right next to you is HIV positive and she's sitting with this and she's like, I can't talk to my sister because I know how she judges people that are living with HIV. So please, let's love one another, guys. Zizifo zabantu ayizozifo zezinja. Zizifo zabantu, zizifo ezi-affecta abantu. We understand? Lots of love. Take care. Till next time.